Hello, everyone. Thank you for joining us. We're going to give people a couple minutes to join. So you are started in webinar mode, which means your video and audio is off. We will have Q&A available throughout, and we'll answer at the end. Two of you who joined at the beginning will get to hear me say this message more than once. Thank you for participating. All right. Well, thank you, everyone. Good evening or good afternoon. The sun is out, so it feels like it's afternoon. My name is Dr. Ben Rhodes, and I'd like to welcome you to the Ventura County Area Agency on Aging's seminars on brain health and wellness. These seminars are a series of informational presentations that are designed to provide critical resources for Ventura County residents living with a dementia-related disease, as well as their caregivers. We're excited to welcome all Ventura County residents who are interested in learning more about navigating local services targeted at optimizing quality of life. These seminars were inspired by the Ventura County Area Agency on Aging's Advisory Council, which has a powerful commitment to make critical resources more accessible to older adults, people with disabilities, and their caregivers. To that end, this presentation will be recorded and available on our website within a few days. This is part of a larger series. Today, we are talking about some specific content, and it's my pleasure to introduce our presenter, Audrey Jarrett, who's the manager of our Health Insurance Counseling and Advocacy Program here at the Ventura County Area Agency on Aging. Audrey is our resident expert on all things Medicare, and I think you'll be encouraged and equipped by our presentation. Now, as you're listening, feel free to type any questions you might have into the Q&A. You can see that at the bottom portion of your Zoom window, just between participants and chat. Click Q&A, type it in. I'll be gathering those up and making sure that Audrey has time to answer them at the end of her presentation. Without any further ado, I'm going to hand it over to Audrey.
Perfect. Thanks. Thank you, Ben. And yes, thank you for joining us this afternoon/evening. I will go ahead and start with my presentation. So as Ben mentioned, this is part of a series of health and wellness seminars specifically focused on brain health and just kind of any and all topics regarding the well-being of older adults and people with disabilities. So today, since I am the HICAP program manager, it is very fitting that I start with preventative screenings and assessments that are available to all Medicare beneficiaries within our county and across the country. So to start, I will be giving a HICAP overview. So what the Health Insurance Counseling and Advocacy Program does, our services and offerings that we provide. You're going to get a snapshot of Medicare, just a brief foundational look so that you can move through this presentation seamlessly, understanding what it is I'm talking about when I talk about the different parts and paths of Medicare. We're going to talk about some preventative services and what part of Medicare they are covered under. We're going to briefly look at cognitive assessments within the Medicare coverage, how to access services, and lastly, advocating for your health, which is a very important component to wrapping this all together. You know, we know that the services are offered to you through Medicare, but making sure that you're able to navigate the system is really important. So to start, the Health Insurance Counseling and Advocacy Program. We provide free, unbiased Medicare counseling and community education to all Ventura County residents. Additionally, we offer community presentations on preventative services, long-term care, senior fraud trends, and screening and application assistance for public benefit programs. We can also assist with billing issues or appeals for services not covered. Our local HICAP office is a part of a national network of state health insurance assistance programs, which essentially means that no matter where anyone lives, whether it be in California, in a different county, or in another state, they have a local HICAP office available to them. What is, I guess, unique about our county is that we are a direct service. So we are housed in the walls of Ventura County Area Agency on Aging, whereas in other counties, it might be a nonprofit organization that has taken the HICAP designation through a contract. So we feel in our county, we have a lot of great services that are all under one roof, which is, I think, how it's intended to be. And we're able to act as a one-stop shop. So no matter if you come in with a Medicare question and maybe you have questions about some other services that you're interested in, we're pretty easily able to refer you to that department just down the hall. So that's a really great thing for Ventura County. To put it into perspective, I like to give the example, we do work with all Ventura County residents because each county can slightly vary with the Medicare plans that are offered or coverage options. So we are experts in Ventura County. If we had someone that lived in Los Angeles County or Santa Barbara County, we would be referring to those counties to provide that service. So Medicare basics. This is a lot of the times a confusing area. People understand that they have Medicare, but they don't understand exactly how that Medicare actually plays out for them. So there are two options within Medicare. There is Original Medicare and Medicare Advantage plans. Part of what we are talking about when we talk about both of these is where someone can go to a hospital, or what providers, what doctor's offices that they can go to, what prescription drugs are covered. This all has to do with the plan that you choose when you are just coming onto Medicare, and then when you review annually. So Original Medicare is any combination of Part A, hospital insurance, Part B, medical insurance, and or Part D, which is the prescription drug coverage. On the Medicare Advantage side, the Medicare Advantage plans cover all hospital, medical, and prescription drug coverage under one network or under one roof. So the difference between the two is one works within a network, which is the Medicare Advantage plans, which are typically HMOs, health maintenance organizations. And the other is Original Medicare, where you're not attached to any network and you can go to any doctor that accepts Medicare patients. So when we talk about in the next few slides about preventative services and the assessments, this is going to be available to all Medicare beneficiaries, no matter if they have Original Medicare or Medicare Advantage plan. Sometimes accessing the services can look a little bit different, and so that's what we want to talk about. But all of the preventative services that we're going to talk about today are offered to all Medicare beneficiaries. So getting into the preventative services, the Part B, medical insurance, is the component of Medicare where preventative services falls under. Medical insurance can be known as any outpatient care. So when we look at the hospital insurance, that's any inpatient care, in the hospital, things like that. This Part B medical insurance, again, is outpatient care, doctor's offices, things like that. There is also the durable medical equipment is covered under Part B. So any wheelchairs, hospital beds, braces, that's all going to be covered under Part B. And it's important to note that no matter what services you're receiving in Medicare, it's really important that these services are deemed medically necessary, which means that they are needed to diagnose or treat your medical condition and that they meet accepted standards of medical practice. And so I like to use the example, especially if we're talking about a DME, a durable medical equipment. Let's say you've hurt your back, you're working with your doctors to find a care plan, and they want you to have this kind of back brace. So getting that back brace covered under Part B should be no problem because it is a medically necessary service supply item. If there's maybe you want the back brace and there's no particular reason or diagnosis of a problem, that might not be covered because in the eyes of your insurance plan, that is not medically necessary. So that is an important part as we navigate through our health insurance, making sure that it is medically necessary services. Preventative services, which encompass a long list. This is just probably a fourth of the list of the screenings, shots, tests that are covered. They are in order to promote your health and well-being. And so I'll get into it into the next slide, but the preventative aspect of these services being covered are really important. Ideally, when you go into Medicare for the first time, you will have a welcome to Medicare preventative visit, which means that you will get an array of tests and screening to make sure to assess where your health stands. And after that welcome to Medicare visit, you're entitled to yearly wellness visits. And this is something that came into place in 2011, which became a added benefit to Part B, is these yearly wellness visits. And so all of these services are provided to you as a preventative measure. When we look at diagnostic versus preventative, we want to make sure that we understand that preventative care is done to detect health problems before symptoms develop. And diagnostic care is given to diagnose or treat symptoms that you already have. So if each year you're coming in for all of the screenings and your flu shot and the vaccines that are laid out as a part of the preventative services that are covered, those are all going to be coded and paid for as preventative care. You're making sure that you're getting those screenings done yearly. Now, if there is a health symptom that is showing itself, or there is a lump somewhere, when you go to get that test, it's no longer a preventative test. It's now diagnostic. It doesn't mean that it's not going to be covered by any means, but it's important to know that the preventative care that we're talking about is anything that's done kind of on a routine basis, that it is done preventatively, not because you're seeing that something is presenting an issue and now you want to get it checked out. That would be diagnostic. So moving into cognitive assessment and care plan services that are offered within the Medicare program. Medicare Part B, the same part with all of the other preventative services that they're covered under, covers a separate visit with your regular doctor or a specialist to do a full review of your cognitive function, establish or confirm a diagnosis like dementia, including Alzheimer's disease, and to establish a care plan. So in addition to that yearly visit, you have a separate visit that's covered that just looks at cognitive function. And it is in place to be able to detect efficiently and effectively dementia and Alzheimer's disease. Signs of cognitive impairment can include trouble remembering, learning new things, concentrating, managing finances, or making decisions about your everyday life. And it also includes anxiety, depression, and can also cause confusion and things like that. So in my research, which largely came from the Alzheimer's Association, they have a lot of great resources as far as how to navigate cognitive assessments and how to, establish a care team and things like that. It was really interesting that there is not one single tool that is used for this cognitive assessment. There is a handful of tools that doctors use to diagnose and establish that care plan. It is interesting that part of this process does include close relatives, friends, what they call as an informant, that can confirm some of this behavior. Of course, this is all done within HIPAA, standards and regulations. It's not to say that they're going to, call up a loved one and ask all of these questions, but they will ask you if you would like that person to, come with you, or if there is anyone that could answer some questions about maybe the trouble remembering, learning new things, concentrating, things like that. So in large part, what the takeaway is that it really does mean establishing that care plan and team. And a lot of the times that does involve family members, usually adult children. So understanding that not only that you have the annual wellness visit, but you also have a completely separate visit to get the full cognitive review. You have that separate visit, you have the right to that separate visit each and every year. So if they say that, there's nothing that's coming up where there's needing to be a diagnosis or an established care plan, they will revisit it the next year. It is a required element in the annual visit for them to at least touch on it, but this separate visit is usually is going to be by your own advocating. You have the availability to it. And of course, a good doctor, if they saw that there was this additional cognitive assessment that is needed, they would push you on to get this full review. But that's where, when we talk about it in just a bit, advocating for your health really comes into play. I like to think of it as when we get those yearly physicals or checkups. I mean, some doctors' offices have the email or the phone call that says, "Oh, it's time for your visit." But other than that, it really is up to you to make sure that you are getting all of the benefits that are offered to you. So accessing the preventative services. If you have original Medicare, you will pay no coinsurance or deductible for certain preventative care services if you see a healthcare provider that accepts Medicare. So that's pretty straightforward. As long as you're going to a provider that accepts Medicare and you're getting these preventative services, most of them you're not going to pay any additional coinsurance or deductible to access these services. If you have a Medicare Advantage plan, your plan cannot charge you for preventative care services that are free for people in original Medicare, as long as you see in-network providers. So that's why we touched on the foundational piece of how to understand the Medicare that you have. It is going to make a difference in accessing those services. If you are on a Medicare Advantage plan, which are typically HMOs, you are going to just need to make sure that you stay within the network. So for example, I always use Kaiser as an example because a lot of people understand how it functions. If I was a Kaiser beneficiary, I'm not going to go to a doctor, just around the corner from my house to get this preventative care service. I need to go to my Kaiser primary care physician to start this process of getting the preventative care services and screenings. So you just need to stay in network when you have a Medicare Advantage plan, but you have all of the same benefits in that plan. You just need to stay within the network. So this is huge. Part of what we do as HICAP counselors and community educators is we are trying to empower our clients, the people that walk through our doors, and the people that we meet in the community. A large part of understanding your Medicare and understanding the benefits of your Medicare is taking the driver's seat. the more educated that you are to navigate the system, the better you are. So with preventative services in particular and visiting your doctor, be prepared, bring a pen and paper, have some questions written down prior to going to that doctor's visit. You've joined this presentation, so you know about the yearly wellness visit, you know about the welcome visit that you are entitled to when you first get onto Medicare, and then every year after. Ask about that. Make sure that you have it on the books for next year. Share information is the second point. It can be scary to share information about maybe trouble remembering things, just forgetting things in general, just odd behavior that might be happening, a lump or a bump somewhere. Share the information with your doctor. They can only help you given the information that you give them. So that's a huge piece. So be brave is what it said on the sharing information portion. Ask questions, right? So you already have come prepared with some of the questions that you have. That pen and paper is going to be there so that you can write it down. The fourth one, get it in writing. That really just means get whatever your steps that you need to do or follow, put that down on paper. What did the doctor advise you to do? Because a lot of the times we go into those settings, especially for older adults, and they might not remember. They might walk out of the appointment and not understand what it is, what was their next step. And follow up. If there's any questions that you have that you need clarifying, don't be afraid to reach out and follow up. And follow up with what your steps are. What did you need to do as a part of what your doctor had advised? So this is really important. A lot of what the people that we work with, a lot of the times I see that they're very confused. And our main goal is to empower people so that they go into that situation and they know exactly what to expect. So I wanted to keep my presentation short and sweet because there's a lot of information that I could go into. If you have any questions, please call us at 805-477-7300 at extension 5, or you can email us any questions at highcap@ventura.org for more information. We are available to, like I said, all Ventura County residents. We can advocate, we can empower you. If you need help navigating a certain system, if you need help figuring out what providers are available to you, what your benefits or what your rights are, we handle it all. So I hope you learned a little something about the preventative services that are offered to Medicare beneficiaries, and that is all that I have. Let's see.
Thank you, Audrey. I learned a lot, and this will help as I talk with friends and family who may be going through some of these assessments and maybe aren't quite as familiar with it. I am checking. I don't see any questions in the Q&A, but I wondered if I could ask one.
Mm-hmm.
So from your perspective, from these conversations about the cognitive side, what's a typical set of questions? Is this the sort of thing like you're going to get, here's a diagnosis, I have early onset Alzheimer's? Is it, hey, this is we need further study? I mean, what type of responses do people tend to get?
So in the annual assessment, it is pretty straightforward. It is essentially, are you displaying any signs, trouble remembering, things like that I had kind of mentioned. If you answer yes or no, if it's yes, they will move you on to getting more of an in-depth review, right? If you self-report that there is, this concern. If the person says no, they will ask to see if there is a informant, that's what the technical term is, that can confirm that there is no, presenting issues. Um,
So
obviously, it's up.
hold on just a second. Did you really say the word informant?
That is the
Okay,
technical term.
translate that for me, because that sounds a little weird. What does that mean? Normal
So
language.
they would essentially be asking you if there was any other, let's say it be adult child or something like that, that could basically confirm that, this person is in tip-top shape. They're right. They haven't been, they're sharp. Of course, that's the piece where you don't have to agree to that or to have someone, have them reach out to someone, but that is a part of that basic assessment. And that's where I kind of point to share information, because a lot of the times people come into a doctor's office and maybe they don't want to share that there has been this presenting issue. So I think they just put that safeguard in place. This was the annual visit and the cognitive assessment. It came onto the scene in 2011. After much research, it's a required element of the annual wellness visit. So it came after a lot of research, essentially pointing to that this is a very pertinent assessment to have. So I think that they put that informant piece, which is really a loved one. It says informant. It's really a loved one to confirm, because I think they don't want people to just say, no, I'm not having that problem, and then see you later. So they are going to ask if there's someone available.
And if someone's going in for that assessment, right, they get to pick the person.
Ooh.
Looks like we had a little blip. I'm
Yes.
gonna say my question again. I think we didn't lose anybody. So what I was saying, Audrey, is if you're going in, if you're the individual who's having the assessment, you get to pick who the doctor talks to kind of get that additional. Okay. That makes me feel better. Thanks for explaining that.
And you could also say, no, I don't want anyone, to be contacted. And that is within your right. But I think they are just trying to safeguard that.
Sure. So this is like, a physical for your brain.
Right.
Once a year, get checked up. If there's any issues that show up, here's the follow-up. Here's how you can get more information. So shouldn't think about this as a scary thing, but it is part of something that we should be doing to check in and make sure our health, and that's why it's covered under Medicare.
Right. And to touch on, so let's say someone gets past that annual kind of that quick, very simple review. There are probably 5 to 6 other assessment tools. Some are just answering questions on what their experience has been, especially if they were to answer yes, that they have been dealing with some of this. I've seen that there have been, basically, they would give you a sentence like, Bob went to the store, and kind of set up a scene, and they would ask you to repeat back the components of the story. So the assessments in and of themselves are not scary. Of course, if you're in there thinking that there might be that diagnosis, I understand that would be scary. But the assessments themselves are just kind of some of those brain working tools. So, yeah.
Well, thank you. Thank you for answering my questions. And I'm going to check. We do not have any more in the Q&A. So I want to thank you. I hope everyone here who's watching live and then on a recorded basis, because the seminar will be available on the Ventura County Area Agency on Aging website, which is VCAAA.org shortly. I really appreciate you joining, and I hope that you benefit from this as much as I did. Our next seminar in this series is scheduled for April 21st. We hope to see you all there. Have a wonderful evening. Thanks.